My name is Simona, and first I would like to clarify that the communities that I'm talking about are the First Nations communities in BC who are on reserve. So I was very fortunate to secure my practicum at the First Nations Health Authority. The FNHA is responsible for planning, management, service delivery, and funding of health programs in partnership with First Nation communities in BC. Now, these services are heavily focused on health promotion and disease prevention while embedding cultural safety and humility into the health service delivery. So just recently, FNHA completed process of assuming responsibility over health services, programs from Health Canada, and now it's in its transformation stages that will allow for analysis and upgrade of these programs to meet the First Nations health needs, while embedding their philosophy and approach to health and wellness at its core. So some of the examples of these health programs and services are communicable disease control, environmental health, nursing services, funding arrangements, and maternal, child, and family health, under which falls the Children's Oral Health Initiative, or COHI, and that's the place where I did my practicum. So what is COHI? It's Early Childhood Tooth Decay Prevention Program for children from ages 0 to 7 years old, and their parents, caregivers, and pregnant women who are residing on reserve. It basically includes dental screenings, they're done annually, applications of fluoride varnishes, dental sealants, temporary fillings, while promoting oral health promotion and education in the community. So why is this important? So when you look, before I get into it, so the purpose of this project was basically to develop a decision-making tool that would support oral health program enhancement and expansion. The COHI program is not currently in all communities. There are 203 communities on reserve in BC, and only 79 are currently receiving the COHI program. So now the question is how to expand in a way that is fair and equitable. So, and including the community voice in the process, which I found very challenging throughout this process. So when we started with a literature review, we want to see what the oral health status of First Nations children are. And the stats are really scary. Overall, in Canada, the tooth decay in children is gradually decreasing. We're ranking as a 5th country out of all industrialist countries in the world in terms of access to dental care. So we should be all getting a equitable way to get to dentists. But unfortunately, within Canada itself, there is a huge gap between the communities and ethnic groups. Some of it is also what type of barriers are, towards the oral health, and how the community is actually ready to receive any health programs. So what is community readiness? Community readiness refers to how well community is prepared to address certain issue. It allows communities to develop their strategies that are culturally appropriate and sustainable, and it is community-driven. So you have that upstream movement where communities are basically from the start all the way to finish and maintenance of the program, and they're heavily involved throughout the whole process. It increases community capacity for intervention and health prevention, and it improves the success of the oral health program acceptance. So I was looking at what type of community readiness models are available. And it was very challenging because there are really not too many, or they're not very well implemented. So the one that was mostly used in the healthcare or programs that are now implemented in communities was developed actually by the Colorado State University, and involves 9 stages of readiness. So unfortunately, this type of model is survey-based. I was not involved in the research. My project was not research-based. So I was looking at other information that can be utilized to kind of approximate the level of readiness of each community. So I was looking at what is available, and it was very challenging to see and gather all data together The COHI department has existing sort of like a spreadsheet from the Oral Health Canada. What information is there is basically socioeconomic status of the community, remoteness, access to dental services, whether a community is traveling outside or if there are dental providers in the community or if they're commuting to the community. And of course, what other conditions are closely related to poor oral health outcomes. So the spreadsheet got bigger because I was able to dig out some additional information. So in terms of social determinants of health, there is something what is called Community Wellbeing Index. And that is calculated, it's a score that's calculated from median income from the community, unemployment rate, and education level of the community. So it gives you a nice score if, depending on of course, the lower socioeconomic status is, the score will be lower. As the numbers go high up to 100, better off the community is and better off they will have, better off they will be with their health. Then there was internal data that I was able to locate it, and that was diabetes rates. That was focused on local health areas. And also hospitalization rates, which is basically general anesthesia rates for First Nations children when they have their teeth restored under general anesthesia at the hospital. But it still doesn't really capture that community voice. And I was looking at health and wellness plans. Each community is coming up with their health and wellness plans that identifies their priorities and needs of the community. So if they're listing, yes, oral health is a concern in our community, it gives us a tool and that we know, okay, that might be the community that is taking steps, being ready to have some action taken. Why is this all important? We want to make sure that these services are brought to the communities in a fair and equitable way. We have to kind of look at a lot of factors. Some of the communities, they may have dental clinic in there, but is it utilized or does it need repairs? So that community will be definitely at higher level of readiness than community that doesn't even, recognize that oral health might be need because there are some other health issues they want to address first. The other thing is we have to look at the budget, of course. Nobody likes that, but there is just limited budget. It would be nice to, have all communities serviced and have equal access or to the dentist at the same time, but it's not something that is feasible. So we have to unfortunately prioritize and see which community has the highest needs, but they're also ready to receive such a program. And in conclusion, there are a lot of factors. Like this tool is at its very, very first steps because we're just gathering the information, what is available, how we can build it up. Of course, so for future MPH students doing that survey, that would be amazing. Unfortunately, it would be like in about 124 communities to do so. So you can see the logistics, like is just doing that on their own, it would be really difficult to do within a timely manner. And I was doing a lot of research for the information, how to include communities' voice. So one way is to develop this close partnership with community engagement coordinators because they are often coming from communities and they know exactly what is happening with each community and what their requests are because that may not be voiced and verbalized in those health and wellness plans. When I was able to attend the meeting with them, they recognize, yes, oral health, we need it. But how do we transfer that information from the community coordinator up the ladder to FNHA? So those are the things that still need to be developed, and developing that network and information sharing, that's really important. I would like to acknowledge all the support that I've received throughout these studies and all the patience from my family because that was endless listening to my ranting. And yeah, I would like to thank you for your attention. Thank you.
Thank you. Excellent. There we go.
Thank you for your presentation. I have so many questions. I'm going to just try and limit it, though. I'm wondering, because First Nations in BC are funded in different ways, depending on a lot of different factors, but some come directly from First Nations Health Authority, and some sort of have those block transfers where they administer their own, have full authority over what they're going to administer, some mandatory programs and some not. And in my experience, there's two things. Sometimes the community, as in the actual community members, may be expressing an interest in something like dental health, but the community leadership, so that chief and council level, might not agree. So that's one challenge that I personally found. And the other thing is that what you mentioned is the funding issue. So I'm not sure, I've been out of it for a few years, but is FNHA able to fund all 203 communities for an initiative like this?
Right. No, those are very good questions. The problem, well, first we need to gather all that information that is available and what type of services each community has. So that was, that's what I was looking at, what type of fund arrangements community has. Because there are three types of funding arrangements, which is set, that's basic, that all communities receive. Then there are flexible and block funding arrangements. So the ones that have block funding arrangements, whatever they didn't use up in that fiscal year, they can transfer it to different programs and basically fund the other programs like COHI. Or they can develop partnership with other communities and to create, let's say there are three communities in Merritt that actually built a dental clinic outside the reserve, and all three communities are using that. So then we have to look at the remoteness, how far the community is. Is it feasible to actually have somebody to be transported out of community to bigger center? Or is it better to bring the health professional to the community? But again, do we have facility for them to do their work? So I was able to add in information from the policy department where they were looking at which facilities are being planned, which ones are under construction. So the oral health department can sit there and look at it. Is it feasible to actually have a room specifically for dental purposes? Not setting up the whole clinic because let's say dental therapists, they can bring their portable equipment in there. So then other issues like when you look at just numbers with medical expenditures and travel expenditures, it doesn't tell us the whole story. Is it because the program is not doing its work, or is it because now people are being screened, they're being diagnosed, and they're reaching the treatment? So going by numbers is very, very limiting because it's just a snapshot of that time what was happening. So they were, when I was going through it, I was realizing it's like a snowball effect. When I think, okay, one thing is resolved, no, there is more to it. So I think just developing partnership, let's say with other programs that are targeting same demographics, that would really help to, narrow down that budget expenses and all that.
Thank you. Actually, I do have one question, and it's about actually the dental schools within Canada, and I just wondered if any of them have any programs that sort of address these very, very important issues that you've mentioned.
That's where the biggest challenge is, because we don't have dental therapy school in Canada. So that limits how many dental therapists are available. Let's say in Australia, they have incentives for dentists who just graduated. They will take away some portion of their student loan if they practice in communities that are remote and serving Aboriginal communities. We don't have that much in Canada here. So we're lacking the school, also education within the schools. There's not much geared towards the public health because dental offices, majority of them is the private practice. It's a business, unfortunately. So there are huge gaps in basically policies, starting, with education and just going down the road. Who is available to serve those communities? Yeah.
Thank you. It's fascinating. Thank you very much. It's
Thank
very
you.
interesting.